Hello everyone, my name is ABDUL-AZIZ SEIDU, currently a public health lecturer at the Division of Public Health and Tropical Medicine, James Cook University. My research interests include social determinants of health, disability and health, gender-based violence, and sexual and reproductive health. I must say I'm very pleased to be joining you today for the second edition of the International Conference on Gender Equality. Today my presentation will focus on the sexual reproductive health of women with disabilities in Ghana. Before I begin my presentation today, I have put together what I call Voices of Women with Disabilities. And these are some experiences that women with disabilities have shared in previous studies concerning their use and access to sexual and reproductive health services. So as I share these experiences that these women with disabilities have shared, I want you to be reflecting on these as we move further with our conversations about sexual reproductive health of women with disabilities. So the first one goes like this. The doctor said, "You don't have strength and you are having sex. You this disabled, you are so promiscuous. How can you be pregnant?" The second one also stated, she was referring to a health worker, said it wasn't her job to be helping cripples lie down on tables. I really felt bad. The last one, it's not that I don't want to go for antenatal care, but my problem is I can't move alone. They normally say if I knew I couldn't walk to the clinic, I shouldn't have gotten pregnant in the first place. And I must say, some of these experiences that they've shared are just a tip of the iceberg in terms of the challenges and problems women with disabilities face in their access to sexual and reproductive health services. This is the outline of my talk with you today. That's from the background. We'll look at disability in Ghana. We'll also look at the Sustainable Development Goal 5, which is talking about gender equality and women with disabilities. Then we'll also look at challenges women with disabilities face in accessing SRH services, then some recommendations and take-home messages. As part of the background to the World Health Organization reports on health equity for persons with disabilities, about 16% of the world's population, which translates to about 1.3 billion people, are living with varied forms of disability. So in other words, what this means is that those of us here attending this conference at this specific time, about 1 in 6 of us lives with a disability. And the World Health Organization and then the United Nations Convention on the Rights of Persons with Disabilities have defined disability as a long-term physical, mental, sensory impairment which in interaction with various barriers may limit an individual from participating effectively in a given society. And from these 16% of the world's population that are living with disability, about 80% are living in low and middle income countries. And from that 80%, 40% are in Africa. Ghana, the most recent census, which is the 2021 census, reveals that about 8% out of our over 32 million people are living with different forms of disabilities. Now, let's focus on how disability is perceived in Ghana. And just like I said, from the most recent census, about 8%, which translates to over 2 million people, are living with different forms of disability. And if we look at it in terms of gender comparison, females comprise about 8.8% of their over 2 million people living with disabilities, whilst males comprise about 6.7% of the proportion of the population living with various forms of disability. So from this, you can see that the number of females affected by disability are more, which is even greater than the national average. Now let's look at how disability is perceived in Ghana. So there's a dual view about how people perceive those living with disability, right? And these are influenced by the socio-cultural beliefs and perceptions. So the first one, persons with disabilities or their families are believed to be the core of their disability. Right, and with this, PWDs or their families are believed to have wronged a deity or a supreme being, and this is one of the main reasons why persons with disabilities are sometimes stigmatized or they are sometimes discriminated against. The other view is that persons with disabilities are viewed as people who deserve charity and pity, and as a result, some people believe that if you do something good to a person living with disability, you are going to get a blessing for doing that. So these are the two main views shaping the perception people have about disability in the Ghanaian context. And let's look at what a woman had to share. In our society, when you are sitting in a wheelchair, people think that you are bewitched. No one wants to be your friend. No one wants to be your family. No one wants to be close to you at all because you are going to curse them. But now, because of existing education and interventions about the cause of disability, some of these perceptions are now reducing. Now, because of the challenges that persons with disabilities and women with disabilities, for that matter, face in various societies, globally there have been some interventions, right? And some of these interventions in the United Nations Convention on the Rights of Persons with Disability. And then we also have the World Health Organization Disability Action Plan, which ended in 2021, and then various national policies and laws. So within the Ghanaian context, we have the Disability Act 715 of Ghana, which seeks to ensure that various policies and interventions are implemented to ensure easy access and social participation of people with disabilities in various social activities. Then the Sustainable Development Goals as well. So for instance, the Sustainable Development Goal 3, especially Goal 3.8, talks about universal health coverage, right? And then the Sustainable Development Goal 5 talks about gender equality. And then there are also non-governmental organizations spearheading a lot of interventions to ensure that the lives of persons with disabilities are improved. There are also various disability organizations as well within the Ghanaian context. Persons with disabilities, their lives are improved. And then of course, there's also a lot of research in this area to ensure that the lives of persons with disabilities are improved, and more importantly, their health outcomes. Now let's look at the Sustainable Development Goals and disability. So the focus will be on gender equality, which is the Sustainable Development Goal 5. But I must say, disability, gender equality, and discrimination are closely related, right? So for instance, while a significant proportion of women were born with disabilities, others became disabled as a result of their exposure to gender-related risk factors, including lack of access to sexual reproductive health services, exposure to violence, and harmful practices, and gender-based intra-household distribution of various resources. And for gender equality and empowerment to become a reality for all women and girls, it is important that specific concerns of women and girls with disabilities are mainstreamed across the entire Sustainable Development Goal framework and considered across all targets for this specific Sustainable Development Goal, which is Sustainable Development Goal 5. So what I'm going to do is to look at some of the key issues across the various targets of this Sustainable Development Goal 5, which is talking about gender equality. And this whole conference is about gender equality. So let's start off with the Target 5.1, which is talking about end discrimination against women and girls. So evidence suggests that women with disabilities lack legal capacity and they have reduced power and status in various relationships, households, and communities. And as a result, they are more likely to face discrimination. What about Target 5.2? So that Target 5.2 also end all violence against and exploitation of women and girls. Women with disabilities are at higher risk of violence due to factors relating to systemic discrimination and stigma. So because of this, they are more likely to face a lot of stigma in their various societies, and the violence perpetrated against women with disabilities, something that has been well researched. And the various reasons for this is because sometimes they have reduced capacity, sometimes they rely on others for their daily living, and sometimes too they rely on others for various support mechanisms. So some of these people tend to exploit them in various ways and also perpetrate some violence against them. Very soon I'll share some of these experiences from some studies that I did in relation to access to sexual reproductive health services. Let's also look at the Target 5.3, which talks about eliminate forced marriage and female genital mutilation. So women with disabilities are about 2 times two to three times more likely to be child brides, right? And they experience early marriages, and sometimes because of they experience early pregnancy. So in most sociocultural contexts, if a woman gets married, the next thing that they're expecting is to give birth, right? So because sometimes some of them are more likely to be child brides, they also experience early pregnancy, and early pregnancy has its various complications. And then female genital mutilation or genital cutting, which has a lot of adverse impact on the sexual reproductive health of women with disabilities. Now let's look at the target 5.4. So the target 5.4 talks about value unpaid care and promote shared domestic responsibilities. Women and girls with disabilities, like I indicated, depend on others for care, but they are often caregivers themselves. Sometimes, because some of them might be staying at home most of the time, people tend to use them as care providers for their children or for whichever care that they want them to give. But they are disproportionately affected by the lack of recognition and social support for unpaid care and domestic work. Then the target 5.5 also talks about ensure full participation in leadership and decision making. So women with disabilities face numerous environmental, attitudinal, and other barriers to political participation. And because of that, they constantly remain largely excluded from decision making and advocacy processes about issues that mostly even affect their life. Let's also look at the 5.6, which talks about universal access to reproductive health services and rights. So the lack of access to sexual reproductive health and rights is among the most pressing concerns of women and girls with disabilities, because they are often not able to make their own informed decisions regarding their sexual relationships. Contraceptive use is sometimes very low among women with disabilities, and they have various access challenges to sexual reproductive services. One of the myths also is that most people perceive women with disabilities not to be sexually active, and as a result, it affects even healthcare providers, the type of care and services that they render to women with disabilities. Now, let's focus on women with disabilities and their access to sexual reproductive services. Women with disabilities face various challenges, including access to sexual reproductive health services. It's a point that I've made countless times in my presentation. But generally, these challenges are grouped into various levels of the society, right? So you can look at it in terms of the national level, the community and family level, the health system level, and then also at the individual level. So I'm going to share some specific challenges at these levels from previous studies and my own studies that I conducted in terms of sexual reproductive health care usage and access among persons with disabilities in the Ghanaian context. So let's start off with the national level barriers. So the first national level is the level of inclusion in sexual reproductive health policy. Part of my PhD, one of the studies I conducted was to look at the inclusion of people with disabilities in Ghanaian health policies. And from the policies that I reviewed, it was found that there's low level of inclusion and the use of even derogatory words to describe disability. So for some of the policies, they describe the woman with disability as, this was used in the context under which a woman with disability can seek abortion care, right? And a woman with disability or a person or a female with disability was regarded as a female idiot. So the use of some of these words are sometimes very derogatory. And then unfriendly health facilities. Most of the health facilities within most parts of Ghana, especially those in rural and remote areas, are not disability friendly. So because of that, access to some of these facilities sometimes become very challenging to those who might be wheelchair users or those who might need support to access these services. And then the public transport system sometimes is also not disability friendly. So because of this, it hinders women with disabilities easy access to sexual and reproductive health services, because depending on where they are living, they obviously have to take transport to access these services. Now, we also have the health system level barriers. So the health system level barriers talk about communication barriers. So the communication barriers are looking at how some healthcare providers are not able to communicate effectively with persons living with disability, especially those with hearing impairment, right? And then can also talk about negative attitude of the healthcare providers also towards women with disabilities. Remember the quote I shared with you earlier about how a doctor talking about why a woman with disability should be pregnant. And then lack of training to meet persons with disabilities needs. These healthcare providers sometimes do not have the required training that will empower them to be able to provide the needed care and support to women living with disability. At the individual level too, they have mobility problems, challenges moving from one geographical area to the other, so which limits their access to sexual reproductive services. And then of course transportation challenges, depending on where they are living, they might also face transportation challenges. And then another important thing is economic challenges that some of these women with disabilities face, because some of these services, whether it is even free or not, you have to pay for transport, you have to sometimes buy medications to be able to get your condition treated, and all these limit their access to sexual reproductive services. Now let's look at some recommendations. So as part of my PhD, what I also did was to look at stakeholders' recommendations on how to improve the sexual reproductive health outcomes among persons living with disability. So these recommendations were synthesized to develop a model that I call the TRIBE model. So within the TRIBE model, the T stands for training for disability sensitive and inclusive healthcare, and then the H stands for healthcare inclusivity, which talks about nothing about us without us. So what this means is that persons with disability need to be or are supposed to be included at various stages of planning in terms of their healthcare delivery. And the R talks about raising awareness for accessibility and equity. There's the need to ensure that a lot of education and then awareness raising about disability issues to erase the erroneous impression about the causes of disability. And then the I talks about impactful continuous monitoring and evaluations of intervention. And one of the interventions that came up strongly was the National Health Insurance Scheme. Aim of this is to ensure easy access to healthcare, right? But some of them share their experiences in terms of how the National Health Insurance is not really as effective as it's supposed to be. And then the V talks about vital empowerment for self-reliance. So if they are economically empowered to be able to get jobs, to be able to make money for themselves, they will be able to pay for some of these services, which will go a long way to improve their health outcomes. And then the E talks about enforcement of physical accessibility. So if you look at the Disability Act 715, it mandates public buildings to be disability friendly, right? But that notwithstanding, some health facilities are not disability friendly. Now the take-home message is for you is that women with disabilities represent a significant proportion of the world's population, and the sexual reproductive needs of women with disabilities are sometimes often overlooked, and they experience barriers including access to sexual reproductive services. So women with disabilities and persons with disabilities in general need to be prioritized to achieve the Sustainable Development Goal 3 and 5. Thank you very much for listening.